So I run small group peer support sessions every 2 weeks. During the session, we essentially go around in a circle and I give everybody the chance to talk about how their week's been. So it's case management, any difficult patients people have they had any good experience of services, anything that anybody else needs to know about, how has their relationship with their GPs been this last week, are they having good relationships with the voluntary community sector, with the GP practices. But mainly it's a chance to kind of bring cases that might be tricky and get advice from the other people in the group.
Since I became a link worker a couple of years ago, I've been attending weekly supervision sessions with my peers. And in those sessions, I think they have been the most helpful of all in terms of helping me to become a better link worker.
We can all have phone calls or interactions with patients that don't go so well, that leave us feeling, like we wish we'd done something better, or, maybe somebody's not kind of responded well to something that we've tried, and that can impact on us, make us feel like we're not doing a good enough job. So I try and kind of role model that as well as myself, as, we're all struggling with the same things. This is a safe place to talk about anything that's gone on, ask any questions. I think that's a really important part of the atmosphere. My peer support sessions are with the people that I line manage as well, so I will often get feedback in those one-to-one sessions afterwards about how beneficial people find being able to get that support from their peers and gain that advice and offload and gain reassurance.
I think that they have really supported me in understanding what other people are doing to help their patients. And I think hearing from other link workers about the difficult cases they've had, about the difficult times they've had in the role, really helps me to feel not alone and less isolated in it. Hearing what they might have done to support a similar case is so helpful, and it takes you out of the panic and makes you feel like, okay, I know what I have to do here.
We always ask for feedback consistently because we're wanting to make sure that this is going to support people in their work. It's for them, so we're constantly asking, is this working? What would be better? What would be more helpful for you to make you do your role as best as you can?
The general benefits for the patients and the clients and the PCNs, I would say, is that they get a really good quality service. Their staff are supported appropriately. They can be confident that the staff themselves are so well supported that they're not panicking, that they're not like scrabbling around looking for things on their own, but they've got a network there, they've got the support to give the clients what they need.
Facilitating peer support sessions is extremely essential for our staff because it gives them a chance to really offload, gain that support from their peers and feel like they're not on their own. It's really rewarding for any service to be offering this support for their link workers so that they can offer the highest quality service for patients.